If you deal with high blood pressure or hypertension, then you probably already know that a healthy diet is one of the most effective ways to manage it. It's important to consume whole grains, vegetables, fruits, and lean protein. Additionally, you should avoid things high in sugar and sodium, which is one of the top dietary factors linked to high blood pressure. We understand that managing any chronic health condition can seem overwhelming, and high blood pressure sure is no different. To help know what to avoid, here is a list of 6 foods that can increase blood pressure. Table salt or sodium. Salt, especially the sodium in salt, contributes to high blood pressure and heart disease. Because sodium affects fluid balance in the blood, excess sodium intake can lead to high blood pressure, a severe risk factor for heart disease and stroke. However, if you consume more than 2300 mg of sodium per day, your kidneys may not be able to keep up with the increased amount of salt and water, leading to high blood pressure. Saturated and trans fat. Our body needs some fat regularly to function properly to absorb nutrients from the food we eat, but overeating fat can be a threat to our overall health. Overeating fatty foods raises the cholesterol level in our body system. Cholesterol is a type of fat that comes from the liver, but we can also get it from the food we eat. Our body needs a tiny amount of cholesterol to function correctly, but too much of it can raise the risk of heart attack and stroke, as cholesterol can build up on the walls of our arteries, which makes them narrower. This way, the normal blood flow is reduced. The American Health Association recommends that reducing intake of both saturated and trans fats help to keep the heart healthy. Canned, frozen and processed foods. Canned and processed food is a good solution for the busy life schedule, but this can be harmful to your body as canned and processed food helps to increase blood pressure. The canning, packaging and freezing process needs a large amount of sodium to preserve the flavor. Unfortunately, high sodium food means these foods can elevate your blood pressure. Also, frozen pizzas and processed food are high in sugar, saturated fat and sodium, and all of these ingredients can raise blood pressure. So to be on the safe side, you can choose the low sodium and low fat version of this canned and processed food. But the better option is if you can make them at home with fresh ingredients. Fried foods. Fried foods are typically high in salt, which increases blood pressure. Also, the oil of fried food increases the body's cholesterol and triglyceride. And we have already discussed the harmful effects of cholesterol on our body. You can find some good alternatives to frying food like grilling, baking, and sauteing. Caffeine. Research shows that caffeine starts to raise blood pressure after 30 minutes of drinking. Coffee is not the only source of caffeine. Also, tea, energy drinks and soda all contain caffeine. Doctors recommend reducing caffeine intake for people with hypertension. If you cannot live without coffee, then find alternative options like half caff or decaf. Also, you can find caffeine-free teas. Alcohol. Regular consumption of alcohol can increase the chance of high blood pressure. Drinking more than 3 drinks can instantly increase blood pressure, and habitual drink can cause hypertension. Many risks are associated with alcohol consumption as alcoholic drinks are high in sugar and calories. Thus, drinking alcohol can contribute to obesity, and some medicine interacts with alcohol, which interrupts the medicine to work effectively. Therefore, your doctor might recommend you reduce the amount of alcohol you drink. AHA recommends not to take 2 drinks per day for males and 1 drink per day for females. What are the best foods for high blood pressure? When you are a high blood pressure patient, doctors will recommend a heart-healthy diet. This type of diet actively helps to reduce your blood pressure. In a heart-healthy diet, food with potassium, nitrates, antioxidants and fiber is a must. Because these nutrients in foods help control blood pressure and maintain sodium effects, you can also follow the DASH diet As AHA recommends it, your regular food intake has a significant impact on your overall health as well as blood pressure. Generally, a diet full of fresh fruits, vegetables, whole grains, and lean protein can keep you healthy and fit. If you enjoyed this video, don't forget to subscribe and like this video. Thank you.